Hormones are the chemical messengers that direct your heart rate, your metabolism, your mood, your appetite, and so much more. Just a bit too much or a smidgen too little can throw off your normal. If your insulin hormones are inadequate, you have diabetes. If you're not producing enough T3 or T4, you have hypothyroidism. And when a woman's body greatly reduces its production of estrogen and progesterone, you have menopause. It may be a natural process, but the sudden removal of estrogen and progesterone can have a big impact.
Menopause is a permanent cessation of menses that occurs as a result of decreased ovarian function. And basically what happens is your ovaries stop ovulating and producing estrogen and progesterone, and as a result, women stop getting their period, and that's menopause. As a result, their hormone levels tend to fluctuate. And this actually is the most bothersome to women because it's that fluctuation in their hormones that causes them to have the symptoms that we typically associate with menopause, which are hot flashes and night sweats, difficulty sleeping, as well as many others.
These symptoms can be debilitating for some women. What's more, these symptoms can last for many years. The average woman reports symptoms 4.5 years after her last period, with more than half of all women experiencing some symptoms for 7 years or more. That's a long time to be at the mercy of your fluctuating hormones. But women don't have to suffer, nor should they.
There are multiple therapies and options that are out there and available. You have to take each woman individually and assess what her risk factors are. But traditionally, we use hormone replacement therapy. Hormone replacement therapy comes in a variety of forms. What's been most studied is estrogen and progesterone therapy used together orally. There are a variety of formulations on the market, but what they do is they basically replenish what your body is losing naturally. And these therapies can be used for a short period of time just to aid you through the first several years after the cessation of your period.
Hormone therapy often involves 3 hormones: estrogen, progesterone, and progestin, either individually or in combination. Hormones can be taken daily or on specific days of the month. It can be taken orally, through a skin patch, a cream or a gel, with an intrauterine device or a vaginal ring. The symptoms will dictate the best form of hormone therapy to ease a woman through menopause. Long-term hormone therapy can pose serious risk, which is why it needs to be carefully monitored.
However, you have to choose your patients very carefully because studies that are out there prove that taking estrogen and progesterone therapy does increase your risk for breast cancer and cardiovascular events. So if someone has a very strong family history of breast cancer, that's a patient that you got to be very careful about using hormone replacement therapy on. Also, alternatively, someone who's a smoker or someone who has a history of high blood pressure or stroke, you have to weigh those options very carefully.
In the right patient and with the appropriate management, hormone therapy is the best option. For patients with risk factors, there are other therapies.
There have been many studies on mild antidepressants like Prozac or Effexor that actually work in different ways to decrease hot flashes. You can also treat the symptoms locally. If you have a woman who's never had a hot flash but is is suffering with vaginal dryness and painful intercourse, you can give them local vaginal estrogen replacement therapy, which will reverse all those vaginal symptoms without giving her the risks of, or as much of a risk of breast cancer or cardiovascular events. There is some absorption vaginally, but very little. And if you're concerned, you can, or if someone has a history of breast cancer, you can always check with their oncologist and evaluate those issues.
Multivitamins, a healthy diet, and physical activity can help alleviate some of the symptoms of menopause. Now, adding soy to the diet can be helpful, but it has to be done carefully. Large amounts of soy can trigger elevated estrogen levels that can affect a woman's risk for certain cancers. Relaxation exercises, stress reduction, and getting enough sleep can also help. Menopause may be natural, but we shouldn't assume that its symptoms are something to endure. If you're suffering through menopause, talk to your doctor. There may be a treatment that can help. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.